So we have been fostering for 5 months. Our first placement was a little guy, newborn, and so he just turned 5 months old. We got him fresh from the hospital, which for us, what that looked like was we were out with some friends at a concert and got a call that there was a need, and then a week later we had a newborn in our house.
Yeah. So, I mean, that week went by really quickly. In that matter of the week, we visited him in the hospital while he was going through some hard transitions, and held him and just loved on him, which was really special to have that time. And then we brought him home, and I just remember feeling like, this is wild. We have a 9-year-old biological son, and our world in the best way was turned kind of upside down. All of our routines were changed, and everything about what we do on a day-to-day basis had to be rewritten. The three of us, as we had known it for the last 9 years, had completely changed. So after a few weeks, we definitely, sleep deprivation was coming in hot, and that was when we're like, maybe we take a night or two for some respite.
Yeah. And you were a strong advocate for that. It wasn't something I really thought about doing, and in fact, I kind of felt like I was betraying him, by like saying I need a break. And but you were very clear that it was important for our family, and then afterwards, I definitely realized that.
Yeah,
so.
And I work in social services, so I know kind of what burnout is and how that feels, and I know that in order to continue to do the good and hard work, you have to take breaks sometimes, and that self-care is really important, and that care for our family is really important. And so knowing we had like a trusted, reliable, and safe respite, it was like amazing for him, but also for us to just like take a deep breath and take a moment. And I mean, when we got him back, after that night, we were like, never leave.
Yeah, right. You become attached very quickly,
yeah.
For sure. Just being able to have a couple nights of like solid sleep to catch up and recenter, and then check in and kind of like build back up your gas tanks a little bit, so you have a little more energy to keep going.
Yeah. But we are so thankful for Child and Family Services and the way that they've mentored and walked through this whole process with us, honestly, from the beginning, getting licensed, all the way to, having that placement of the child and that worker coming in. I remember sitting in the hospital when our caseworker came in, and she like sat down, and I was holding the baby, and she was like, "How you doing?" And I was like, "Really good, and I feel really peaceful." And she was just like, "So this is what's next." And so every step of the journey has felt like we've had people that are helping us too, which is pretty wonderful when you're entering something widely unknown.
Yeah, for sure. I'm a nurse by trade, and so like whenever I have a patient come in for a procedure, a huge part of my flow is like being able to explain this is what comes next and helping them know what to anticipate, and it relieves anxiety in a huge way. But I'd never really had that done for myself, so
yeah.
Like to be able to receive that kind of this is what to anticipate and expect, and this is what's coming ahead, it really makes a huge difference. So the team has been awesome.
Yes. So if you're interested in respite care, we would really be so grateful as a foster family that's walking through it. And we've since touched base with so many other foster families that utilize respite care, and it has been the thing that has kept them kind of going on down the line, and as Gerald said, fills up their gas tank too. So yeah, it's a changing thing you can do, not only for a kiddo but a foster family, and guaranteed your life will be changed too.